So how excited am I to be able to introduce this next session? When I heard about Samsung's collaboration with UCSF, I thought, how cool is it that a major consumer electronic company is working with a major healthcare provider, and I happen to be in San Francisco, so all the better for me. So I'm going to introduce them, and then we're going to cut to a video, and then they'll begin their great conversation. So I want to introduce Dr. Michael Blum. He's the Associate Vice Chancellor for Informatics, Professor of Medicine in Cardiology at UCSF. And I want to read to you his New Year's resolution: to live more intentionally and to spend more time doing the things he loves doing. So let's cut to the video.
So good morning, everyone. Thanks so much for coming. What a wonderful, wonderful turnout. Hope everyone's enjoying the show so far. I have the pleasure of being here with you and with President Sohn from Samsung this morning to talk a little bit about what we see coming in the very near future in the digital health space from Samsung and how we're working together at Samsung and UCSF. So we just saw the beginnings of the voice of the body strategy from Samsung. So why don't we start right there, Young, with what does voice of the body really mean to Samsung, and follow that with why now? What's going on now that you think is the right time?
So voice of body is more about our attempt to communicate the opportunities that we see in terms of knowing more about ourselves, so that we can be able to impact our health through better behavior and better change. And I think that just like what happened to automobiles 30 years ago or 20 years ago, some of you may remember that you have to check your oil by dipping in the stick and or checking your air pressure by opening it up and plugging in the things. But now you don't do that, right? It's in your dashboard. It tells you a lot more about what's going on in your car. And I think it's an attempt to really understand more about our body by using technology to communicate our vital signs. That was really the project around voice of body, and that's something that we are really interested in doing. Why now? I think a few years ago, people talked about this as well, but I think back then, maybe a bit too early. But why now is in sense the technology is ready to go, in my view. Particularly the power of mobile phone, smartphone that you have in your pocket. I'm sure all of you have it. Hopefully it's a Samsung phone. It's 40,000 times greater than when I was in Intel, long time ago, 1983, when we came out with a PC. So if you think about the amount of power that you have with connectivity, and then the cloud platform that can give you essentially the data that you need in real time, almost real time, so that you can be able to learn a lot more about what's going on, is there now. And I think I couldn't say that a few years ago, and I think it's going to get only better. The sensors and algorithms need to be developed. So I think we have an opportunity to continue to work on it, particularly for better data. But I think there is an opportunity to connect these things to enrich our lives and really impact our lives in a proactive way. In long term, I think it will reduce health costs. It's going to help us to live better, and it will help us to be more preventive rather than dealing with the post-clinical issues.
So that makes great sense. So the compute power is here now. There's a tremendous amount of work going on in the sensor development and the beginnings of fantastic work with big data and with algorithm development to really change things. And from my perspective as a cardiologist, and I do a lot of prevention work, really making that transition from chronic disease management to looking at people as consumers and prevention and wellness makes great sense. That's what we do all the time. The question I get asked a lot is, okay, that makes sense for UCSF, and the compute and the technology, the phones make sense, the mobility makes sense for Samsung, but what about the health piece? I mean, people usually think of you guys as phones and so on, and what about Samsung and health? Tell us a little bit about that.
Right. So first, for Samsung Electronics and the Samsung Group has been in health business, so it's not new. We have one of the largest hospitals in Korea. We also have a health imaging business that we've been working on. So we're not a new player, but I do think that this is a very disruptive time in that traditionally the products that we make, whether it's a mobile phone and others, being a more of a communication device that could now apply to an integral part of how we live and then impacting our lives. So I think in that sense that digital health, I guess that's what we call, or connected health, is very important time, and we are investing heavily, try to be participating in a way that are collaborative, mainly because we are a consumer company that doesn't really understand clinical need. So how do you bridge those two? You bridge it through partners like UCSF and IMAX and others that we work with. And also creating an open platform where other players can join in. So, and I think it's really important that we recognize that we cannot do it alone in a new space. We bring some things into the table, but we need to work with other players to make progress here.
So creating this open platform is incredibly exciting, and looking at the data that's coming in has traditionally been one of the challenges in this space. There have been, hundreds of digital health devices, wearables introduced over the last 12 and 18 months. There are many more here at CES. What do you look for? What are the distinctions between things that are just interesting and would get worn for a little while and then go away versus ones that are really going to persist? What are going to be the transformative elements of the digital health revolution?
So I think we're in a very early stage. I cannot say that I try all kinds of wearables myself. And usually in a couple of weeks, I put in the closet. I'm sure some of you do the same. So it's not an essential part of my living yet. But I believe that it's coming, and I believe that it's going to get better. I think one of the most important things is the accuracy of data. And without that, I think we will lose credibility on a lot of these devices that are trying to accomplish. But like any pioneer work, it requires a energy, it requires an investment, it requires smart people coming in. But I do think the timing is right, mainly because it's easy to put that together. And we got infinite amount of capacity in the cloud, as well as multiple data that can come through. And with a better analytics and machine-to-machine learning, I think we're going to learn a lot more about us than we ever have known, mainly because I think we can even have 24/7 monitoring around our body that we could not have done in the past. And those things are just starting. So don't think of today as the kind of a checkpoint. But I think there's a first round of American baseball game analogy, right? We're the first inning, and more to be coming. And I think we will be going to much more deeper, much more reliable, much more essential part of our living as things get evolved.
So you're looking down the road to devices that are really going to become part of people's lives, like their phone is, not the devices that are out now. I think it's worth touching on the UCSF Samsung partnership, because that's a lot of what we're looking at together, is the excitement of having the technology expertise and the deep engineering and the investment capabilities of Samsung are so important. But when these things need to get into the clinical space, they need to get to the providers, we need to have the utmost confidence that, as you were saying, the data is accurate, that the data is reliable. And we are in a very early phase. So a lot of the work that we do at the Digital Health Innovation Lab is doing that validation that the new sensors coming in, and not just the Samsung sensors, but partner sensors, really do have the accuracy that we expect in a clinical space. As clinicians, we can't just have everyone sending us or emailing us the data that's coming off of whatever device they're wearing. It needs to get into the clinical space in the right workflow. But then we need to be able to feel that it's accurate data, that it is really reliable data. But then there's a next step after that, right? Because people aren't going to continue wearing these devices if it just creates some interesting data. It's got to create data that's meaningful and valuable to individuals. So how are you thinking we're going to make that transition from the earliest devices that people just got steps or they might get heart rate to devices that are going to generate value. What's Samsung's part in all of that?
So there's a couple of things we have done for open platform. Some of you may heard about it. One is around what we call SIM-band. SIM-band is a open platform where any third party can be able to plug in your sensors and algorithms to run it without reinventing the watch or reinventing the communication protocol. So, and I think something that we like to encourage anybody that are interested in creating a solution for blood pressure or glucose, some of these major challenges that we have. And if you have an interesting approach to do it, you don't have to create a whole new platform. You can plug in and test those. And if those things are working well, you got a direct pipe to potentially impacting very large supply of solutions that can go out to the consumer electronic channel. So that's one. The other one is the data. And I think that, I don't think anybody want to just see raw data because there's a lot of data. In fact, our SIM-band 24/7, you can generate 1 gigabyte of data a day. That's a lot of data about you. But I think what matters is the trend, and what matters is the change, and being able to have a smart algorithm that can be able to pick up those things that are in a cloud, along with probably other sources of data. It doesn't have to be just the data on your heart rate variability. It could be data around your activities, about your diet, combined, that I think we have a very powerful way to learn more about our bodies. And that area is, I think, very new. I mean, I'm very interested in talking to people that are trying to figure out how to use this data to make some sense out of it. And that's an area that we've been working with partners. We've been looking for partners as well. We have a digital health fund. We've been investing in companies. I think that last year we invested in 12 companies in the area of digital health. And we'll continue to invest startups that can help us to learn more about insights, because that's a part of learning we must do, not just measuring, not just getting data, not just sending data to cloud and getting the doctors overwhelmed with the amount of data, but we need to give some insight. And in fact, at the end of the day, we want to have a behavioral change that are happening to each consumers that are experiencing it.
That just creates this really phenomenal opportunity that is, transformative is thrown around all the time, right? Everything's disruptive, everything's transformative. But if you think about it, the ability to really know what's going on minute by minute over days and weeks is a fundamentally different way of looking at individuals than we've had in healthcare. And it really creates the opportunity where we can rethink a lot of the treatments that we deliver. We don't know how to treat patients when we're really looking at their blood pressure over long periods of time. We know what happens when you come into the office. So this really creates this fundamental opportunity. But there's a lot of excitement that when you have big data, you're just going to mine the big data and it's going to give you answers. And I think it's important to really talk about how that's just fundamentally incorrect. You're going to get suggestions, inferences, associations. You're still going to need to go back to the traditional methods of figuring out whether those things really make a difference in people's lives. And I think that's the highest level that we're trying to get to in our collaboration. We start with, does it measure accurately? Right. Does it measure things in individuals, in real patients who have real lives, and real people who are practicing wellness? Is it accurate there? But then eventually, does it really bring value to individuals, to families, to healthcare systems? And that's going to require years of work to really understand. And that's a little bit different than the time frame that people are thinking about with a new digital sensor. It's got to be out in 6 months. It's got to be in. These things are going to be bringing together the traditional years-long investigations with the very rapid cycles of digital innovation. I think that's one of the most exciting parts. Things are going to look very different in 5 years. So if you talk 5 years down the road, give us your guess at what things are going to look like 5, 10 years down the road.
I think that your comment on taking time is absolutely right. I think that we look at a lot of startup companies, a lot of sensors and algorithms, and there's a lot of good brain going in there, which is good news. And there's money going in there too. And I think there's a little bit of hype going on digital health as well, because there's a lot.
A little bit.
Yeah. So, but you know what? I think hype, maybe you can look at negatively. The good news is people are investing, and smart people are following. and multidisciplinary of the medical field and health fields, as well as the semiconductors to sensor people and software people are coming together trying to solve the common problem. So I think that's really a good news. I think that wearable, the way we look at it today, will be much different in 5 years. I think that mobile phone as the collection and agent of communication would not change. I believe smartphone will be always around. But how are you going to wear that? Is it part of your fabric? Is it part of your jewelry? Is it part of your glass? I think these are all opportunities that we need to make it seamless integration to our daily living so that it's not some patch that you wear. I mean, I wear a patch as a way to test, and I think it works pretty well. But after a couple of days, it gets a bit irritating. So unless I have to, I don't think I want to do that. So there have to be a change that are much more seamless. And I think the other area of the change is really data. Like I mentioned, there's a lot of data that are coming out, and a lot of them are garbage. So we need to make sure it's a good data, and it's data that can also talk to each other, so that fragmentation have to be addressed, because everybody has their silos. And silo, in a way, because they have no other choice but doing it. But eventually, when these data come together, then I think there's a lot more power. So we need to figure that out without compromising privacy issue. Because now we're talking about your EKG, your blood pressure, and you really cannot be able to just share that information like marketing data you'd get out of some other e-commerce companies. So we need to think about how to protect the privacy of one's information as a part of this discussion, because it's much more about you, your identity, and about your biomarkers that we need to think through. And then lastly, I think that in 5 years, I think we're going to not only doing this information about our vital signs that are moving in, but also the genomic informations and others coming together. I think we can decode much better about us. So I think it's going to be around gathering the data, analyzing it, making sense of it, but I think things are going to be much more economical, so it's easier to do.
Yeah, and you're really getting to a space that at UCSF we call precision medicine, where that's really being able to understand the individual in front of you with a vast amount of data, not only about them, but about hundreds of thousands or millions of people who are very similar to them and what's happened to them over a period of time. That gets into one of the areas that people are starting to talk about more, and that's when we're tracking people and we're tracking all of their vital signs. People are starting to talk about the creepy factor that's coming about when we know everything about you and we know everything you're doing. That seems to, and that gets to the privacy issue for sure. And then once you put genomics in, it really gets to the privacy issue because there's no de-identifying it. Once you have someone's genome, it's only their genome. The early days of digital health and wellness have seen people who are really, the quantified self. They're really dedicated advocates of collecting all this data. They tend not to worry so much about the privacy or the creepy factor. How do you see this playing out into the bigger, more general populations? Is it just something that we're going to get over once we see it? Or is it going to be because the devices are so valuable that people are going to get past it? What do you think?
Well, it's I think even today, all of you that has your phone, if you want to, I think can learn a lot about your driving habits. How fast you're using accelerator, how fast you're turning your corners. So there's a lot of things that are already there in your phone. There's 9 sensors that are built in. They can check your speed based on specific location, and based on accelerometers, the turns you're taking. So there's a whole bunch of data that are already out there. So there is clearly a increasing sensors and wearables. We're going to have more data. And I think it is a public policy issues, and I believe that these data have to be your data. Banks, they may hold your money, but it's not their money, it's your money. and you have a right to do what you have to do there. So I think we need to have a really important debate about public policy on privacy of this information, particularly as you're getting into much more sensitive information.
Yeah, I think that's right. I think that we tend to shy away from that robust public debate. I think everyone starts from a place of this data needs to be very private, and everyone starts with that foundation, but then what private means and how much you're willing to give up, because you have to give up some privacy to have the data flowing everywhere it needs to go. If you keep the data completely private, well, then it sits on your phone, which is better than nothing maybe, and you can talk about it, but without the ability to really get it into the entire clinical care
Like your
continuum.
comment about being able to study within an anonymous way on the population study on certain things will have a definite impact in progress in health, and we need to have that ability to do that. But same time, you don't want to have specific names of data that are out there as well. So these are very fine balancing act.
And as you're going through developing the SAMI.io platform and so on, is the privacy already baked into that, or is that something that you're going to build as you go forward?
Well, I think the SAMI, by the way, is our SAMI.io is our cloud platform where any third party can go in and be able to deposit, ingest, and also being able to work with the consent of users on understanding more about your data. So this is a cloud platform that we built, and it's a development platform. And we welcome any third parties to join that. I know example would be there's a company called Blum which manages, I think, monitors pregnancy. In 3 hours, they figure out how to use their sensors attached to our SAMI and get a data around the real-time information that are coming from pregnant women around their contractions, as an example. So this type of things are happening real time, and they can then correlate with body temperature and other things to learn more about that. I'm just giving that as an example of how third-party companies can come in and join the SAMI.io platform as a way to integrate. But I think the important thing there is that data doesn't belong to us. It belongs to you, to whoever is owning the data. So we are facilitating the platform to enable it.
And there are lots and lots of good examples of partners who are coming to work at the Digital Health Innovation Lab with UCSF and with Samsung, or approaching us. How would folks who have good ideas, who have either analytic ideas or sensor ideas, how should they get in touch? How should they reach out? Right.
We have a website that you can reach out to our ecosystem team. So we can publish those. And we have folks that are focused on working with third parties. So we do sensing, we do investment, we even do collaboration. Sometimes we'll actually finance the project if you think it's interesting. Or we do join innovation lab to bring in to validate the ideas, because sometimes we don't know that it's going to work. So we will go through the trial together as a way to accelerate the process. So this whole area has so much to learn and so much to explore. We don't have all the solutions, but we think we can work together with the community to make progress here.
Yeah, and I think I would encourage people to say if they have a new idea and they need to develop it and work on the algorithm, to reach out to, if they have something that's already really well down the road and it needs validation, those are the capabilities that we have in the collaborative, the Digital Health Innovation Lab, and they can reach out either to Samsung or to the Digital Health Innovation Lab at the Center for Digital Health Innovation at UCSF, and we can figure out the best road to get there. So our time is really flying by here. I want to give you the opportunity, because there are always so many things that I forget to ask some of the important questions. What is there that we really didn't touch on that I should have asked about that you see as one of the nuggets we want to make sure the audience picks up on? Any real?
Well, I think that we are in a very early stage. There's a lot of potential opportunities, and I think that we need to continue to improve the experience and make, at the end of the day, data does not change. We need to use data to make an impact, which in turn will impact behavior change. So very interested in preventive health, and anything that can impact the preventive health by using better technology, we welcome anybody to work with us to enable that.
Yeah, and the only thing I would add to that is that we talk about preventive health a lot, and we talk about lifestyle modification a lot, and really creating consumers instead of patients and so on, but we really don't talk that much about behavioral health. And we don't know that much about how we're going to get people to really, the devices to remain sticky and people not to put them in drawers and to have persistent behavior modification. So I think we need to encourage people, algorithm developers, app developers, analytics, around real behavioral health issues, because without that, we're really not going to get through this initial transformation period.
Yeah, absolutely.
Yeah.
Thank you.
All right. I think we're at the end of our time.
Thank you so much. That was perfect timing, perfect session.